note of that. All right, so before we get into the meat of the meeting, as usual, I'm just going to start with the overview of the rules of engagement for virtual meetings. All members were muted at the start of the meeting and participants have been muted. We ask that if you have any points of order, if you could please use the raise hand function or otherwise use the chat function to do so. We ask that audio and video be turned off to help improve the quality of the line. However, if you are making an input, please do feel free to use your camera and once you've concluded to then switch it off. If you will be having a presentation today, we ask that you flight it for the duration of the presentation and once it's concluded to then unshare. And then, of course, the maintenance of order for today's meeting comes from the directives for sittings of the House and meetings by electronic means, which were ATC'd on Friday, the 17th of April, 2020. Right, so the purpose of today's meeting is to engage with some of the umbrella bodies that are responsible for the care homes for the aged in the Western Cape. And we're asking them to tell us a little bit more about the preparations that have been made to help the 60+ age group get registered on the vaccination registration system, or the EVDS as we all know it, and any planning that they have in place for vaccine rollout and readiness. So I'm very happy that we have some familiar faces returning to the ad hoc committee today. We have Ms. Christine Quickfall from the Badisa head office. We have Ms. Lucia Smuts from the RCF head office, and we have Ms. A. Kirsten from the Cape Peninsula organization. Please be very welcome to our meeting today. We're going to start with their presentations, and I think we'll have all three presentations first, and then we'll have an engagement between the members and those umbrella bodies. So a very warm welcome and thank you very much for your time this afternoon and for joining our committee yet again. Could we perhaps start with Badisa?
Thank you, Chair. Whilst I'm sharing, I hope it's this one.
If you need any assistance, please let us know.
Tell me, are you seeing it now?
Not yet.
Yeah.
Sometimes it takes a few seconds.
If we just try it again, and if I don't get through it, no. I can't manage to find it immediately. Shamise, I have forwarded it to you. Will you be able to share it with the participants, please?
Ms. Jones, could you flight the presentation for us, please?
Thank you, member. I'll just ask Wasima Hassan Musa to assist me as I've got power outages at the moment.
Okay, I'm still trying. Share content again.
I'm going to try and share it now.
Okay. I'll give you a few moments to do so.
Chair, whilst we're waiting on her, I will not waste your time any longer. I'll just start talking through it whilst we're waiting for that to be shared. Thank you so much for the opportunity. Joining me today is Sister Christel Klopper, and she is responsible for coordinating our total COVID-19 response within the organization. I'm also experiencing load shedding, so I'll just change to my phone. It will last me for at least half an hour, should you need me for some additional time. I think I will start off by just emphasizing that our approach to vaccination was very similar to how we approached the first phase or first wave of COVID-19. Our approach, our systems, our processes were similar, meaning that we centralized policy, tactics, messaging, immediate troubleshooting from a centralized position at our so-called head office. And we also had our local critical reaction committees taking ownership for operationalization. And the same approach is guiding us through our vaccine response. Once you have the presentation, you can read on everything that we've done during that phase. And why I'm using it is to emphasize that our vaccine approach is based on the trust that we've built during last year, that first terrible uncertain time, and reliability of our tested systems and approaches. And this is how we deal with the vaccination at this point in time. What we've done is, in January already, we've developed change management protocol with responsibilities and time frames. And generally, because we believe in the 80-20 principle, we focused on awareness raising. We availed verified and reliable information, and that's the information that we received from the Western Cape government and the WHO. And that also included myth busting, and prepared PowerPoint presentations. We imported some local professionals to assist with the messaging and the reliability of messaging. It's medical professionals, pharmacists, etc. We had structured or forced structured engagements with staff, the client groups, as well as their families around these factual information. And then we also extensively made use of our social media platforms to raise awareness. And they used me too. I'm a 60-pluser. So it's just incidental that leadership, as an example, could be used. All of our sites assisted with registration. We centralized, for example, at one office that everyone will register there. We involved families in the decision where people could not take their own decision or were uncertain. We also imported a management information system because we need to understand the reasons for people not wanting to get vaccinated, as well as the numbers of those not vaccinated. Obviously, it's also a risk for our residential facilities should especially our staff choose not to register. We're busy with targeted follow-up now that we know more on why people are hesitant or what very often they are practical issues. We're following up on that. And in some communities, especially rural communities, we're very proud of, for example, in Swellendam, our critical reaction committee involved youth and trained them on the factual information on vaccinations and got them to move into communities to bring the correct messaging and then try and assess what the challenges are and bring them to our central points where we assisted with registration. The current status, as on the 7th of June, we get weekly updates. At our programs for older persons, we have 55% of the staff vaccinated and 45% who opt not to get vaccinated. We're very proud of our 73% residents who are currently vaccinated, and we're still in the rollout phase, and 27% who chose not to. Only one of our persons with a disability facilities got or was included in the current rollout phase or prioritized by the Department of Health. And there 54% of staff and 45% of residents are currently vaccinated. And it's a rolling positive target. We perceived or we saw a fairly steep positive curve for the past 2 weeks especially. I'm with the last, very short presentation. I'm with the last slide. And Chair, my input today will be incomplete if I don't thank or give credit to the professional and exceptionally compassionate staff of the Department of Health. And thank also the Department of Health for inclusion of Bedisa, Sister Kloppers specifically, on the Vaccination Advisory Committee. They really assist us with accessing reliable information, with processing, troubleshooting, and they're really very responsive is the feedback that I got. We still experience challenges. I know today is about older persons, the 60 pluses, but the fact that our essential staff at our child and youth care centers, our children's homes, as well as our social workers, are not in the lineup for vaccinations, and I can just emphasize that they are classified as essential workers as per the labour's definition. And then it seems as if the 60 pluses at our sites for persons with disabilities are also, it's a slow rollout to them too. The second one, the sites at our persons with disabilities, is something we can take up within that advisory committee of the Department of Health. But the one on the vaccination of essential workers, who we believe can also or must also be regarded as frontline workers, is something that we would like your assistance on. That shares my very short presentation on how we're dealing with vaccinations.
Thank you very much, Ms. Quickfall, for that presentation and very interesting statistics there. I'm sure there'll be quite a number of questions there, and thank you for the work that you've done. I'm going to, as I mentioned, we'll go through all three inputs first, and then we'll leave the questions for the after. So next, I'd like to welcome Ms. Lucia Smuts from the RCF. Are you on the line?
Yes, I'm on the line.
Thank you. Good afternoon. Please go ahead.
Thank you. Can you see the presentation or not yet?
Yes, we can see it.
Right. Our communication to the residents about the vaccination program involves the following. The RCF communicated all the relevant information to the residents and the staff. Posters were placed up upon the walls of our residents and service centres. Management and nursing staff assisted with the communication process. We had weekly meetings were held with the residents to inform them about the progress of the vaccination program and the registration process. Our family members assisted management with this process of informing residents about the vaccination program. Throughout this whole process, managers continue to contact the offices of the local Department of Health for updated information and about the vaccination program so that they could inform the staff, the residents and their family members. Management compiled newsletters which were specifically sent to staff, the residents and the family members about the vaccination programs. These newsletters contain information gained from scientific articles. The challenge was to overcome the resistance against the vaccine due to fake news and the articles published in the media. Local doctors and pharmacists assisted the management with information. During the weekly meetings with residents, management informed the residents that they have to decide if they wanted to receive the vaccine. In most cases, residents and their relatives were asked to indicate their choice in writing. Relatives of a resident who is no longer residents who no longer has the ability to decide for him or herself communicated their decision in writing on behalf of the resident. Thereafter, those who indicated that they wanted to be vaccinated signed consent forms. Some relatives prefer to register their own parents, but still use the cell phone number of the manager. Consequently, the manager received these vouchers numbers. Staff who received vaccinations at an earlier stage shared their experience with residents and other staff, which gave reassurance about the vaccine. The registration process. Initially, residents, family and staff were hesitated to register for the vaccinations. As soon as the EVDS system was available, the manager started to register the residents who agreed to receive the vaccination on the system. Managers also registered the essential staff members who requested to receive the vaccination. Newsletters were useful when communicating the registration process to the residents and their family members. Amenities were made available to residents and relatives to assist them with the online registrations. Wi-Fi was being made available to our residents and the staff to encourage them to register. Some individuals experienced that the EVDS system required more than basic computer literacy. Initially, not everyone who registered received voucher numbers. A facility in Bellville experienced problems with the EVDS system. They repeatedly tried to upload the templates, but the system did not permit information to be uploaded, and at the end, the staff have to email the information. The vaccination rollout itself. Homes requested that their facilities may be used as vaccination stations, but for their own residents and staff. Thorough planning was done to set up 4 stations, for instance, pre-screening, administration, vaccination, and observation. The administration and vaccination processes were well planned and proceed quickly. Safety regulations and social distancing protocol were adhered to by the staff and the residents. Vaccinations were administered at different locations in the homes as well as in the frail care facilities. The external officials requested that specific equipment such as a bed, wheelchair, and power supply must be available in the vaccination areas. Some officials requested more chairs and tables, and some homes even prepared snacks for the officials. The RCF nurses assisted with sharing information regarding the residents' comorbidities and other illnesses. At our Lamberts Bay care facility, there was a 101-year-old resident who received the vaccine, but the person 105-year-old refused the vaccine. Problems that we've experienced. Staff from a care facility in Bellville had to wait in the long queues at Karl Bremer Hospital despite prior appointments. On the morning of the vaccinations for residents at the Bellville facility, the department informed them that the facility is not registered to receive vaccinations. This was despite the fact that the representative of the department came to visit the care facility before giving a date on which the vaccinations would take place. On the day of the vaccinations, the official continued to say that only a limited amount of vaccinations could be administered because he was still waiting for the National Department to confirm that vaccinations can indeed be administered at this care facility. After much discussions, vaccinations were administered at this facility over 2 days, and everyone who agreed to receive the vaccine were vaccinated. Other problems that we've experienced, a number of the care facilities had already ordered their annual flu vaccines prior to the announcement of the COVID-19 vaccination program. When the appointment dates for the COVID-19 vaccines were received, these facilities stopped with the flu vaccines to try and adhere to the required 14 days waiting period before COVID-19 vaccination. Managers felt that there were no coordination of dates between homes and the vaccination teams. So many residents already received their flu shots and therefore could not be vaccinated immediately. Certain districts did not receive enough vaccines and there were shortages, while other districts had a surplus and even staff and management were vaccinated. Some staff members requested to be vaccinated as well, but the officials refused. Some home managers refused to administer the vaccines to staff and residents at the same time because of staff were required to be available to care for the residents who might fall ill after being vaccinated. Some residents and staff become sick with flu symptoms after the vaccinations. Arrangements to take staff with the facility transport or hired taxis or buses to local vaccination stations was at a high cost. Transport was arranged for the staff and the shift lists were adjusted so that there would be enough staff left on each shift to take care of the residents. The manager of a home in the Cape Metropole tried her best to make the necessary arrangements for the vaccination, but with no final dates for vaccination. This is still the case at this stage. The feedback was that there were no vaccines available, but they heard about older persons standing in lines at the hospital and clinics who were receiving vaccines. There is a concern that not all residents will receive their second vaccination within the due time. I shortly would like to share with you something about the RCF community-based care and support centres. The managers of these centres sent out bulk SMSs and emails and newsletters to the members to inform them about the registration process. The centre members are elderly citizens who live at their own homes but receive care and services at the centres. The managers arrange home visits to assist the elderly with the registration process. More and more family members requested the centres to assist the elderly with the registration process. A concern was that many of the members did not yet receive their voucher numbers. Despite all the efforts to register members, they still try to visit the vaccination centres and stand in lines for up to 2 hours without receiving a date or being registered. Some centres were informed at short time that the vaccination take place the next day and there was not enough time to notify all the members. From the 13th to the 14th of April 2021, there was this Velepo Pepa train on the railway in Swellendam. The staff assisted the community with the healthcare issues there, and most of the local members had an opportunity to register for the vaccinations. Suggestions and requests. Members gave the following suggestions. Can the vaccinations be privatized and managed by various medical funds, and can it be done at local clinics? Can residential facilities administrate the vaccinations if there's professional nurses who are trained to do it? I will leave you with the following remark and maybe a question. A second round for vaccination at residential facilities, since many residents and staff are now more in favour to receive the vaccinations. Just a final thank you. The RCF would like to thank local action committees, especially in our rural areas. Bredasdorp, Suideroord facility, who was selected for a pilot project for the Cape Agulhas area. The Department of Health officials for their continued support and assistance. A thank you to all our provincial hospitals like Helderberg, Karl Bremer, Paul, Stellenbosch, Swellendam, Bellville Day Hospital, Grabouw Day Hospital, and many more. All our medical doctors and pharmacists to render their services free of charge. The Department of Health in the Winelands District for delivering such professional service. We also want to thank the RCF National Council, our volunteers, and all the RCF care home managers, centre managers, staff, our professional nurses and nursing staff who have been walking the extra mile and have been extremely reliant during these challenging times. Thank you.
Thank you very much, Ms. Smuts, for that presentation and for sharing that information with us. Also extremely interesting, and you can see a lot of care has gone into assisting your residents with the vaccines. Our final presentation then is from Ms. Kirsten from the Cape Peninsula Organisation. I'm going to hand over to her for her inputs on our topic this afternoon, and then we'll move on to some questions. Good afternoon, Ms. Kirsten.
Good afternoon. As discussed, I did not do a presentation. I will just take you through what CPOA has done. Unfortunately, I had to join in late because of load shedding, and I couldn't hear what the other people or members discussed. But what I can say is that I can only echo what Lucia Smuts said about all the help that we received from local government, the hospitals. Everybody was really on board and assisted us through the process. What CPO has done, we have registered all our residents, whether they were in a care facility or independent residents. Our managers assisted them all, they registered, and we have received, a few of them have been vaccinated already, 3 of our facilities. 2 have been cancelled, and it was due to logistics. So hopefully we will get new dates in the weeks coming. But it's been a very good process. Everybody was on board, very efficient. We can really not complain about the process that so far. We've got 27 units that we've registered, and of those 27 units, 7 of them have been vaccinated successfully already. And so CPOA, some of our staff have registered to do the vaccination training so that we can maybe with the second round be more available to do some of our own vaccinations if we can get our hands on the vaccines. So that's what we've been doing, and we are looking forward to this. And I must say, at first we had many residents, even staff, that didn't want the vaccine. And now that a lot of people have been vaccinated and you don't hear in the media about any negative side effects in South Africa, more of the residents and staff are coming on board to be vaccinated. Our company is really, we are trying to encourage everybody to have the vaccine, although there is some that is not really interested to have it. But that being said, everybody to their own. And yeah, so that's it from us. Maybe I can just say that we've been very privileged. We had our own COVID unit, which we manned throughout the whole COVID process, which really helped us a lot to get people that were symptomatic out of our villages and our care centers into a dedicated COVID unit, and that really helped us a lot to curb the flow of COVID into our homes. So if anybody is interested, we can maybe share that information with you. How did we go about doing that? And to help assist the other facilities as well. That's it from me. Thank you very much for that. And I apologize for not being able to have heard and seen what everybody else has shared.
Thank you very much, Ms. Kirsten. Not to worry, we're all struggling with the difficulties of load shedding, so you're not alone. Let me just put my camera on there. There we go. All right, so we had 3 very interesting inputs, and thank you again to your organisations for the assistance that you provide to the elderly in making sure that they can get registered and to help with the vaccinations themselves. I'm now going to go to a round of questions or comments, and this is a conversation with the 3 organisations present and the members. We have 3 political parties present, so I'm going to go use a raise of hand way of taking questions rather than going through the usual 3 minutes per party, because I think it would just be more efficient for based on today's meeting makeup. So I see a hand from Honourable Bosman. We'll start with you. However, if you would, members, please just indicate who your question or comment is directed to, which will just help with the flow of the responses. Okay, let's start with you, Honourable Bosman, and I'll ask the organisations if you just make a note of the questions, and I'll take a round of questions and then give you each an opportunity to respond. Okay, Honourable Bosman, over to you.
Thank you very much, Chairperson. Chair, my question, the first question is for all 3 organisations. And I'd like to know, I'm grateful that Badisa has indicated their support for the work that's being done by the Department of Health, but I just want to know whether they are satisfied with the support that is being provided by the Department of Social Development in the Western Cape. And then the research from Badisa is quite interesting in terms of the proportion of people who registered in their care facilities and those who chose not to get vaccinated. I was wondering if they could expand a bit more on what some of the reasons were that both staff and residents at the care facilities gave for not wanting to get the vaccine. And then if they could also, if Badisa could also perhaps give us a breakdown of the age groups that the staff fall under in their child and youth care facilities, because it would be interesting to see whether those adults would be classified as teachers in the next round of vaccinations. Thank you very much, Chairperson.
Thank you, Honourable Bosman. Next up is Honourable van der Westhuizen.
Thank you, Chair. Chair, my question links on to what Honourable Bosman has just asked regarding the percentage of both staff and patients, or how do you call your clients, in terms of the Badisa percentages. Again, Chair, I don't want to speak on behalf of the Department of Health, but I think a request that people or those that do the vaccinations must come back again and again is a little bit awkward, because we need to vaccinate as many of people as possible in the shortest possible time, subject to vaccines being available. And I would like to urge all three organizations to rather try and spread the message that when the people come, you must please sit and you must be vaccinated, and not hope for a second visit or a second or third round of visits, because you may have to wait for quite a considerable time before all these facilities have been covered. I can't imagine that people would come back for a second visit unless we've been able to cover especially those facilities in the rural areas where long distances need to be traveled, etc. So this is my first one, to please call on you to really encourage the people to be vaccinated during the first visit. The second one, perhaps, Chair, if you don't mind me just saying what we learned from a previous meeting of this committee from Dr. Keith Kluter, HOD of the Department of Health, is that since medical staff have been vaccinated, they've seen a considerable drop. I think they've seen a 100% success rate, where vaccines have now prevented those staff from, being infected with a COVID virus. So really, it is, in my mind, the only effective way of going about in protecting the people in these homes. But then, Chair, just one question again to all three of these organizations is, what has been your policy in terms of indemnity, particularly for those people in your care that are not able or are no longer able to decide for themselves? Have you asked of family members? Do you have specific family members that have got a proxy to sign on behalf of those? Because I do know that in some cases, some of the care facilities were extremely reluctant and they were very, very sensitive to not have people vaccinated without them being indemnified. Thank you, Chair.
Thank you, Honourable van der Westhuizen. Next, we have Honourable Heron.
Thank you, Chairperson, and thank you for the presentations. My first question to all three presenters is about the actual numbers. The percentages are interesting, but I think it's more useful for us to know what the actual numbers of residents that have been vaccinated in each of the three organizations in their facilities. My second question also to all three is whether they permitted non-residents to participate in the vaccinations that were taking place in their residential facilities. So people from the community or neighborhoods, did they participate and also get vaccinated? I thought the statistics from Badisa were quite interesting. 73% of the residents were vaccinated. I think that's quite a high number. So I think well done to them. But what is the impact for a residential facility where 45% of the staff declined being vaccinated and 27% of the residents declined? What is the impact for the immunity within the facility? I don't understand how effective the vaccination program is when such a high number of staff members in particular are refusing to be vaccinated. And then just fourthly, a comment on the suggestion from RCF about a second round, which I think maybe we should as a committee pass on to the Department of Health, because I would imagine that residents seeing others being vaccinated and going on their merry way may reduce hesitancy, and so a second round may well be indicated. Thank you.
Thank you, Honourable Heron. And then the final question in this round is from Honourable Lecker. Over to you.
No, thank you, Chair. Let me welcome all three presentations that have been done. I must say that the three organizations have really worked ensuring that people out there get the necessary information, but I'm really, Chair, worried if you have 45% of people who chose not to vaccinate one way or another. That has a direct impact on those that have been vaccinated. Of course, we know there has been reports that suggest that some of the people who have already received the jab have also contracted the virus again. And it worries me then if in the same environment there's people who have chosen not to be vaccinated. We also know that in some communities, people have not received SMSs inviting them to facilities. Some have opted to walk in some centers to get the vaccination. And I think it's really important for us as the committee to make a recommendation to the department to really think about a second visit, or not even a second visit, a second chance to some of those who really thought maybe COVID-19 was a myth, or who didn't believe that they can be helped. Now that there are those who have received help, and to see if there's another possibility. But Chair, I'm really interested in wanting to know what is, particularly to those who are employed by the department, are there any steps that are going to be taken to ensure that the employees in those homes are taken to task? Because once you are tasked with the responsibility of caring for people, and yet you take a decision not to be vaccinated, it worries me. So is there a process of taking those into task, but also kind of educating them on the implications of their decisions as people who are supposed to be looking after those senior citizens? Then my second question also around that is around the issue of poor planning from the side of the department in instances where in Kalbrema people were told there's not enough, and at a later time they are vaccinated. What steps are there in ensuring that everyone gets the vaccine as per the order? Because everyone sends a request via an SMS, you get invited to come to an institution, and when you get there, you must first negotiate whether you will be receiving the vaccine or not. For me, it shows a clear sign of poor planning from the side of the department, and maybe we must ask the department what steps have they taken now in remedying that kind of situation, because it has been pointed out specifically for Kalbrama Hospital. Then the last one is, can we have a concrete program detailing as to how many people, perhaps to the department, have received the vouchers, and those that have not received the voucher number, when are they going to get those vouchers? Maybe have they received the response from the department in respect to the vouchers for those that have not received? Thank you.
Thank you, Honourable Lecker. That then concludes the round of questions. I will take responses in the order that the presentations were made. So I'll start with you, Ms. Quickfall, if that's okay, from Badisa.
Thank you, Chair. I hope I can make sense of all my quick notes. I think first and foremost, we as Badisa acknowledge, as we're actually now in the same position as we were in February, March last year, where no one really knew, and one actually tend to forget that we were all running around and trying to learn from this unknown, I wanted to say, thing now. I think we're there again, and our position at this point in time is we acknowledge that we're learning together. We acknowledge that all systems will not be up and running in the smoothest way that we would have wished for, but also is the instruction to all of our programs, or whether they're essential services or not, to try and enable government to make this thing happen. I think that is my first acknowledgement that I can make. We know that this is not smooth sailing, and we partners in all of it. Honourable Bosman, you asked about whether or not we're satisfied with the Department of Social Development. We are in constant communication with them. They're actually immensely supportive in us and enabling us to remove barriers, very often perceived barriers. I, as a matter of fact, had a meeting with them on Wednesday. And yes, some of the things are out of their control because the whole vaccine process are being prioritized, dictated processes, everything by the Department of Health. And what I would recommend is closer alignment between DSD and DOH, for especially those elements of our population that I highlighted in my presentation. In terms of the age group of our child and youth care centres, our children's homes, I don't have the immediate information at my disposal. We can surely make that available to the committee within the next couple of days. I don't know a lot about the rollout of vaccines to teachers, and that would, I assume, be a perfect opportunity to also prioritize those categories of essential staff. Honourable van der Westhuizen spoke about, I just want to decipher my own notes here, about the awareness interventions that we've had. And I'm also going to answer part of Honourable Bosman's questions. Our approach was that let's hit all of our programs with general awareness and solid information. And that was based on the principle that scientifically they say you then cover about 80% of the population. And then streamline the rest of our interventions to convince people to get vaccinated, concentrate those on the remaining 20%. Now, in my assumption also in my response, we cannot assume that the 45% and the 55% are all those who absolutely refuse to be vaccinated. It can also be attributed to the Department of Health not reaching those sites as yet. I know too little of the specific reasons at this point in time. Perhaps Sister Klopper might have some information in that to reliably tell you that this, and the other are some of the reasons. The fact that, and I'm aware at least of that, as they see some of the residents, some of their friends in the facility getting vaccinated and not having side effects and not having an allergic reaction, that also helps, because I was present at one of the facilities where a couple of them came to the phone and said, can't we get vaccinated now? But obviously they were not enough. They only catered for those who were registered. I agree with you that it is totally unreasonable now that the Department of Health has made the effort to go to our different sites, and between us and RCF and CPOA there must be many sites. It is labor and resource intensive, and what we from our side will then do is to, once we get those additional ones registered, we can move them to the increasing number of sites created by the Department of Health. So I totally agree with you. Remember, it is to our advantage to have as many people vaccinated, residents as well as staff, because of the scientifically proven advantage of getting vaccinated. In this regard, I must say in January, February, we were strongly of the opinion that we must have a policy of enforcing vaccination of especially all of our staff. We had a couple of, at least two legal opinions on this, and a third one on a labor opinion, and we were strongly advised against taking that stance. But again, it's uncharted waters, it's untested whether or not an employer can force, for the very good intentions that we all know of, to get all staff vaccinated. We are in the process also of creating new messages based on and video clips and stuff based on the experiences of those who already got vaccinated. In terms of the families and indemnity and stuff, yes, we involved all families where people, even if people, a resident, for example, was, and I don't know the English word, toerekeningsvatbaar, and they still refused. We then contacted resident or their families to say, are you sure that this is what you want to do? In terms of the actual numbers, I'm just quickly going through my detail here. At our old age homes, the actual number of people, staff who were vaccinated, 875, and 2,401 residents that were vaccinated. We are grappling with, just to add on to what you've previously said, and our stance on whether or not we must make it compulsory. It's also an ethical dilemma that we're struggling with, and the jury's still out on that. Not all of our sites have been visited by the Department of Health. It's still part of the process. I think it will take another 2 or 3 weeks as per our agreement with Department of Health. And I think we will know more after, I guess, in 2 weeks' time, exactly where we stand and exactly factually logically what we can do. Honorable Lekker, I do understand this, and it was the same with us. People are not getting SMSs, but what we found, and that is especially in communities, but also our own residents and staff didn't get, who qualified, who was registered, didn't get the SMSs. But our experience was that once you registered without an SMS, you can actually get to a site the numbers are expanding, and we're keeping track of those expanding numbers. Also, even if they come visit our facilities, the only requirement is that they are registered. If they're not registered and decided a day or two before the time that they actually want the vaccine, Department of Health officials also assisted them with actual registration. I don't know whether there's anything that I've missed, Chairperson, from my side.
Thank you. I think that covers everything. Can I just check with the members if there's anything outstanding? Doesn't seem so. Thank you very much, Ms. Quickfall. We'll then move to RCF Fairfair and Ms. Lucia Smuts. Over to you.
Okay, thank you. I've also made some scribbles here, so I hope I will be able to answer all your questions. I think we've worked hard in RCF Fairfair to empower our people, specifically our residents, our members, our staff, to really make a choice. If they want to have the vaccines, we can assist them, and we will register them and help them with that. And we really have done that. For me at this stage, to give actual numbers is a bit difficult because these things are changing a lot from day to day. And a lot of the appointments that we have from the Department of Health at our homes will go until deep into July. So, but I have already actual stats. I don't have it right here with me because I really think it changes every day by day. One of the things that really hit hard on the staff and residents was this fear of the negative effects of the COVID vaccines. I think people have listened to a lot of people from the community on what will happen to you if you take the vaccine injections and all that stuff. And I think at the end of the day, yeah, we really try to really help them to understand why is it necessary. And that's why we really, so a lot of the homes make use of doctors that can give them the correct information. We really want to say a great thank you to the Department of Social Development, who really was the so-called middleman and giving all the different forms, sharing all the information, the posters and the stuff to us. As I said, we've already said thank you to the Department of Health for their work, but DSD also was really keeping us all up to date with the whole process. Then when it comes to the indemnity forms and the proxy, in RCF we usually make use of the different forms when a resident apply to get into a home, and then we usually put a proxy in place from the family side. One person in the family is the spokesperson, and that person must share the information that we as a home give to them, and they will share that information with the rest of the family. So therefore, we've made use of consent forms, and that the proxies sign that consent forms to say that it's okay for a family member who can't talk for themselves that they must get the vaccinations. One of the things that we find from the staff side, why they didn't, well, they actually have to make a choice. We educate and say you have to make a choice for this vaccine, but most of the staff, especially female, will say, I'm a bit afraid, I still want to get pregnant, or I am pregnant, what will happen to me? That was some of the things that we've received back from staff specifically. But yeah, I really say that we tried very hard to educate as much as possible, but at the end of the day, it's still people's own choice if they want to be vaccinated. We really have put the platform in place for them to do that. There was something about the SMSs. What was that one about? Yeah, that's all that I have to say at this stage. Thank you. If there's any questions that I left out, you're welcome to maybe ask again.
Thank you, Ms. Smuts. I just want to check, is anything outstanding from the members? Does not appear so. Then finally, over to you, Ms. Kirsten. Thank you, from the CPOA.
Thank you. I can again just say, being the last person to speak or give feedback, that I can just echo what my colleagues have said. With regards to support from DSD, we can really not complain. Anything that we have forwarded to them, we've received feedback timeously. The only thing that we did pick up was the same kind of documentation that was required. So DSD will send their documentation onto us to be complete, and then Department of Health will send theirs, which was basically the same information, which we felt could have been more centralized, and with one document that went out to ask the same information. What we've also found is that some of the documentation was, we want this a week later, now we want to have more items added to our list. So maybe that process should have been streamlined a bit, but we also realize it's new to everybody, and there will be all these confusional documentation sent our way. So we do appreciate everything that they've done, and the way they have worked with us, communicated everything with us. That to me was actually, we really did appreciate that. Honourable van der Westhuizen was inquiring about the percentages and the time frames. Our residents, we have 2,364 residents in our facilities. Of that, 897 has already been vaccinated, and 129 has refused the vaccine. So some of our facilities, we've got 12 facilities that haven't received dates for vaccination yet. So we are, as an organization, working with the residents, keeping them informed. We've displayed all the notices that we've received from Department of Health on areas, on notice boards in our facilities where residents can see this. The managers are actively working with the residents, reaching out to them without putting a lot of pressure on the residents. We are encouraging them to receive the vaccination. As I said previously, we have registered all our residents on their behalf, and it's then up to them to come and show up for the vaccination on the day that it was scheduled. 2 of our facilities have received dates and was cancelled on short notice due to obvious reasons, but we're waiting for those new scheduled dates. But the majority have received their dates, and we can just compliment everybody on site that came, that assisted us. It was done really very professional. We have accumulated the documents pre the visit of the vaccination. where we asked the family members, and the family members that couldn't, or residents that didn't have family members, our managers or administrative clerks, they completed the documentation. So when the staff that did the vaccination came on site, the residents could just wait to be vaccinated, which helped a lot with the completing of the documentation. So yeah, all honor to those teams that is really working hard. I just want to check my notes here. With regards to the indemnity and the proxies, we've sent out an indemnity form as well as a refusal form. So those that choose either, they could just complete the form so that we can have it on their file. We are not forcing anybody, staff or residents, to have the vaccine, although we have a very positive outcome on all of this. I mean, as I said, 129 residents out of 2,364 that refused the vaccine. And this number might drop as time goes on and people get vaccinated. Yeah, I think I've basically covered most of that. Don't know if there's any outstanding questions.
Any outstanding questions, members? No, doesn't seem. Great. So well done to the three organizations. That was quite a number of questions that you managed to cover successfully. Thank you very much for that. We do have time for another round of questions or comments. If members would like to raise their hands if there's anything further or if they have any follow-up questions. I see Honourable America.
Thank you, Chair. Can I speak? Chair, given the propensity of this virus to mutate in the environment where there are a number of people who are not vaccinated, and having regard for each case to be treated on its own merits, it is still, to me, as expressed by Honourable Lecker, concerning that there's a high proportion of staff who are reluctant to be vaccinated. And I take note of what Christine said about their advice in terms of a labour law perspective. I have a different perspective, and given the unique environment in which these staff operate, they could possibly expose themselves to disciplinary measures should they are the ones who are largely responsible for infecting the residents that they work with. As I was saying initially, that each case will be judged and evaluated on its merits, but certainly PADISA in particular and the other care facilities should implore and encourage their staff to be vaccinated and make them aware of the possible consequences in terms of their employment security should they persist in and refuse to be inoculated against the virus. Thank you, Chair.
Thank you, Honourable America. Are there any other questions? Going once? Going twice? All right, that then concludes the questions. I'll hand over to the organisations.
Chair, I will start again. Now got used to the order. Thank you, Honourable America. As I said, yes, is of an extremely high concern or big concern for me too. What I've indicated earlier is that we're giving it another 2 weeks to see whether our enhanced or deepened awareness or mobilization of people will have any or a more positive effect. And I commit myself to that because of the dangers that it poses. The second thing that I will commit myself is to revisit, or now that people know in January, that was the legal opinion, that we can't force staff. And I will certainly, now that we know more, now that we have more facts, for example, go back to those legal or those legal practitioners and ask them, did something change in the environment, for example? Perhaps within the labor context, it was tested already and we have a better foot to stand up on, because I certainly don't want to be dragged without any legal support before CCMA. That's also so intensive, energy sapping, whilst we're fighting all hands on deck this pandemic. For us, there's also some unintended consequences if we think about employment security, if this is where it might lead to. I don't want to bore you now today with the very unique challenges that our sector is being faced with, especially as a result of the brutal effects of the pandemic. So the other side of the logical part of my head is saying, shouldn't we try and retain welfare infrastructure? By that I mean expertise and experience, and rather find more innovative ways around getting people to voluntarily engage the will to get vaccinated. That certainly will form part of our second level of engagements on vaccination. Thank you, Chair.
Thank you very much. Ms. Smuts, would you like to make a contribution?
Yes, I would like to say the following. We will definitely take the advice from Honourable America. We're going to be personally involved in the homes. I have 3 regional managers under me in the RCF region, specifically the Western Cape, and we are definitely going to be personally involved with each home and with the staff members to make sure that everybody get the message and that we really would like them to register and be vaccinated. We will put our efforts into that. Thank you.
Thank you very much. Ms. Kirsten, would you like to make a final input?
Yes, I can also just say that it is our company's prerogative to make sure that everybody is safe. We have spent lots of time and energy to ensure that every resident, every staff member get the correct information. They are constantly being motivated to be vaccinated. And I also think coincide with our government's guidelines that we are not enforcing this on anybody. I think if, like my colleague has said, if we pursue it from a different angle where it becomes more of an upliftment of the staff instead of enforcement, I think that can maybe change the view of the staff, although we do not see that in our organization. The majority of the staff have already received it or is planning on having it done. They've also, most of them have been vaccinated when visited by the groups that vaccinate on site. So I think we do not see a problem as yet.
Thank you very much. I think then that concludes the engagement today. And, you know, on behalf of the committee, we're hugely grateful to Badisa, to RCF and to the CPOA for the work that you do for the elderly in the province. And thank you very much for coming to share this information with us today as the Ad Hoc Committee on COVID-19. It was really lovely to have you at our committee again. And we're very grateful for these engagements. It helps us to understand better what is happening in communities, how the vaccine program is being rolled out, and you're an essential partner in that. And so we'd like to say thank you very much for your time on this Friday afternoon. Thank you very much. The committee will move on to some administrative work now. You know, you're most welcome to leave the meeting. However, I don't know if you'd like to make any concluding remarks before you do so. Ms. Quickfall?
Just to say thank you very much for the opportunity, and thank you for trying and removing our barriers, understanding our context. Our only two barriers is the one that if Department of Social Development and the Department of Health can work better together to troubleshoot the challenges we're experiencing. Secondly, if you can help with the vaccination of our essential workers at our child and youth care facilities as well as our social workers. And thank you so much for the opportunity. Goodbye.
Thank you. We will include some of the issues that you've raised in the meeting today in our committee report, which will then be sent to those two departments. So we will raise those issues with those departments directly through the Provincial Parliament. Ms. Smuts, any final remarks from you?
No, I just would like to say thank you for the opportunity. And yeah, it's a privilege for us as RCF to work in the older person sector.
Thank you kindly. Ms. Kirsten?
Absolutely agree. Thank you for the opportunity and thank you very much for what this committee is doing. We really do appreciate it. Thank you. Have a good afternoon.
Thank you. Likewise, please all have a lovely afternoon and our gratitude to all three organisations. Thank you. All right, members, can we please then move on to some resolutions and actions from this committee meeting? As mentioned, I'd like to ask if the procedural officers could take note of the concerns that were raised relating to the Department of Health and Social Development and the communication there. We'll include those concerns in our report to be able to send to both. Aside from that, are there any other requests or recommendations from members? Please raise your hands if so. Okay. I was also going to say that there is, as always, the opportunity to pose additional questions or raise additional resolutions or actions by 12 o'clock on Monday. But I do see two hands. Let's start with you, Honourable van der Westhuizen.
Yes, thank you, Chair. It's clear to me that we still need an advocacy campaign regarding the benefits of vaccination. The percentages, I think we were all a bit taken aback by those high percentages of people that were reluctant. And, you know, we fortunately also learned that, you know, now that some people have seen that their colleagues have not had any adverse effects, now they also want to be vaccinated. Now, I think if we could spread the word that, you know, there are very few negative effects and that the advantages far outweigh, it just seems to me as if, as a province, we need to really get onto this and get even more high-flying people, well-known people over the age of 60 to be able to testify that that, you know, this is to our advantage to be inoculated. You don't need to die from COVID anymore if you're over the age of 60 and if you've been vaccinated. Thank you, Chair.
Thank you, Honourable van der Westhuizen. Honourable Bosman.
Thank you, Chairperson. Chair, if I could ask, I'm not sure if it's something that we ask the Department of Health in the Western Cape or something we'll have to ask the Department of Health nationally, but would it be possible for this committee to get a breakdown of the channels that people are using to register for the vaccine on the EVDS system? Perhaps it would be useful to see whether people are using the online platform, whether people are using the SMS or USSID platform, or whether people are using the WhatsApp engagement tool, because it would be really interesting to see what the over 60s are struggling with and what some of the barriers are, and perhaps that would be helpful in informing how government rolls out a vaccination and the registration communication plan for the next age groups, specifically those teachers and child and youth care workers. Thank you, Chair.
Thank you, Honourable Bosman. I think we could pose the question to the Provincial Department of Health. They may hold that information, and if not, then they may be able to get it. If not, then we'd explore other avenues of how to get that information. So yes, certainly we'll include that in our request for information. Anybody else?
My hand is up, Chair.
So apologies, Honourable Lack. I was looking further down the line. Please go ahead.
Thank you, Chair. Chair, as I indicated earlier, that maybe we must request for a breakdown in terms of those who have registered and has not yet received the jabs. What are the numbers per district in the province, and perhaps what is a remedial action to be taken in addressing the balance of people that have not received the jab. And then the second one, Chair, maybe to see if there could be in areas where people might have missed. Great example would be those who were not interested but now has really seen that it's happening. Is there a possibility of a second chance for those who are over 60? Just to check for those. Thank you, Chair.
Thank you, Honourable Lacker. We will include that then. Right, if that's all on this meeting today, we'll include that in the minutes today. Then we have a few minutes and reports to adopt, but also there's a few other items I'd like to discuss with the committee. The first is the weekly report that we receive from the Department of Health that you all get, which has hospital admission numbers, oxygen use, testing and so on, that the committee took a resolution on, I think, early last year. And since then, the Department of Health has been sending us that report. I wanted to test if everyone is happy with us expanding that report now that we're firmly into the vaccine rollout. I had received a suggestion from Honourable Heron that we expand the reports to include the different phases of the vaccine rollout, the number of vaccines received from central procurement, and the number of vaccines administered. In addition, I would like to propose that we add the number of registrations per phase of the vaccine rollout, and then also the number of vaccines sites that are operational. So are there any objections if we include an additional section to the weekly report, which would be based on the vaccine rollout?
No objections.
No objection, Chair.
Okay, thank you. So then I've listed those 5 points. Let me just repeat them quickly. The different phases of the vaccine rollout, number of registrations per phase, the number of vaccines received from central procurement, the number of vaccine sites operational, and then the number of vaccines administered. Would anybody like to add anything to then that vaccine section?
Chair, I would like to add, and perhaps if you could include the district, would be very useful to ascertain in terms of where the bottlenecks may be.
Are you talking? So are you saying the number of registrations per phase and district? Is that what you're saying?
That's correct, Chair.
Per phase and district. Okay. Okay. Anybody else? Okay, all right, then thank you very much, members. We will then write formally to the Department of Health with a committee resolution to expand the weekly report. Honourable Philander, sorry, I see your hand.
My apologies, Chair. I just wanted to ask, those vaccines received and administered, will that ultimately give us, if there were any wastages?
Sorry, you're very soft, Honourable Philander. Honourable Philander, we can't hear you. I think you're on mute. Maybe you could put it in the chat box. Okay, maybe there's a problem with her microphone. Honourable Philander, you're welcome to then send that on email if you can hear me. Then there was just another thing, which was the communication to parties from the Secretary today regarding non-compliance with COVID protocols by political parties represented in the WCPP. So I would like to request a report from the Secretary on this matter to gauge how regularly different parties are reporting on the health status or COVID status of staff and members. Not the detail, but the number of reports submitted, because I think it's important that we are all held responsible for COVID compliance within our own institution. Is there any objection to requesting that report?
No objections.
Okay, thank you. All right, that's it from my side then. So we'll then quickly move on. We have the minutes of the 31st of March. And the minutes of the 25th of May, and then the committee report for March. I'll just ask the procedural officer to please flight the minutes of the 31st of March, which you've all received. Then we'll just go through those very quickly.
Chair, I'm going to load it now. I'm just having a little bit issue.
No problem. In the meantime, I'll just announce that the next meeting of the ad hoc committee will be on the 23rd of June. We'll be having a briefing from the Department of Health on the third wave vaccine rollout and also on the new vaccine Centre for Hope.
Chair, possible, can I load the 25th of May?
Yes, perfect, no problem. We don't have to do them in order. So let's start with the 25th of May. There we are. On the screen, please check attendance. Okay, moving on to page 2. Was the briefing from the Department of Health. And page 3. Okay, if there are any edits or amendments, please let me know. Honourable Bartman.
Chair, I move to adopt.
Thank you. May I have a seconder? Thank you, Honourable America. The minutes are duly adopted with no amendments. Can we then move to either the committee report or the minutes of the 31st?
Sorry, Chair, this minutes is not opening on my side. I'm going to try Shamise to do it.
Chair, I can share the minutes from my side. It's Gillian Bosman.
Thank you, Honourable Bosman. That would help. Then if Ms. Hassan Musa could just prepare the committee report in the meantime. All right, there we go. Check for attendance. Moving now to page 2. That was the briefing from SAPRA and the Health Department. Moving on to page 3. Right, with the resolutions. Are there any edits or amendments to the minutes of the 31st of March? Honourable Bartman.
Chair, I move to adopt.
Thank you. Honourable van der Westhuizen.
Supported.
Thank you. The minutes of the 31st of March are adopted with no amendments. Thank you, Honourable Bosman, for facilitating that. And then finally, we have the committee report for March. The first page is the same as all of our monthly reports, so we can move through page 1. Page 2 is also, again, the background which appears in all, as well as the rules of engagement, which is the same, which we've signed off several times. Then moving on to page 3, the themes for this particular month was intergovernmental relations and community cooperation, as well as health department sponsors, responses and preparations. I won't read the rest. You've all got the report yourselves. So then page 3, any edits or amendments? None. Page 4. Page 5. Page 6. Page 7. Page 8. And page 9. All right, any edits or amendments to the monthly report for March? If there are none, can we move to adopt? Honourable Bartman.
Move to adopt.
Thank you. Honourable van der Westhuizen.
I will second that proposal.
Thank you very much. The committee report for March 2021 is then duly adopted. All right, members, we'll then see you on the 23rd of June. Thank you very much for your participation in this meeting. I'd like to thank the procedural officers for their assistance in organising today. We will then see you on the 23rd. Have a lovely afternoon further. The meeting is adjourned.
Thank you, Chair. Have a safe weekend.
Bye-bye, everybody.
Thank you. Be safe.
Thank you. Bye.
Thank you. Thanks, Wasima. Clarence or Shiraz, can somebody